this is a condition that you're born with. The heart develops within the first 20 days of pregnancy. So before you even find out that you're pregnant, the child's heart is formed, and unfortunately in our case it did not form correctly, so she is missing the left ventricle. Hypoplastic left heart syndrome literally means small left ventricle, left heart syndrome. So Dawn Louise has a severe case, which means that she has no left side whatsoever. She had open heart surgery at 6 days old, 3 months old, 6 months old, and 4.5 years, along with 8 cardiac catheters, the last of which was in October 2023, and we are looking at having another one done possibly this year or next. So because there is no cure for this condition, none of these surgeries actually fix the problem to a sense of they're fine, they're healthy. She will always be sick to some degree. The reason that she has not had a heart transplant is because that is our final option. That is the very last thing that we can possibly do for her. And this is the hardest thing to explain because it depends on so many different things. So basically, and I really hope I'm explaining this well enough, so let me know. Basically, if she had not had her first open heart surgery at 6 days old, she would have passed away. It is completely fatal within that first week of life, especially her condition being so severe. She was only given a 20% chance of making it. So if you can imagine how painful it would be for a newborn parent to lose their baby, their first thought is not organ donation. And because of how tiny a newborn baby is, the newborn baby's heart is only the size of a walnut. An adult heart is not going to fit into that chest cavity. The only way to transplant a baby is with a baby's heart. So unless a newborn baby has passed away, they are just simply not available. And even as Dawn Louise gets older, or other kids like her, heart transplants do come from deceased donors, which means that you are going to have to wait for somebody to pass away who has the right kind of blood type and such to match your own body, which means that it's also incredibly hard to get a heart. On top of that, there are currently children in hospital whose surgeries have not worked, or they were not a candidate for whatever reason, who have spent over a year in hospital on what's called a Benlin heart, which is an external pump that basically does the heart jobs for it, but you can't leave the hospital with this device. And obviously we haven't been through that, so I can't really speak to much degree on that, or the valves, which is the other option. This is why I don't do these videos. I'm better at YouTube videos where it's structured and I can cut things out. So basically the problem is, first of all, you've got to find a heart. Second of all, it has to be a match, obviously, and then